Can you have that three things you have to do, right? Name exchange, explain what you want to do, and permission. All right, obviously permission. Never touch patient without asking permission. Never, 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 never. Then of course you have to have chaperone. You know chaperone? Somebody neutral within your when during your examination. I do not care. I do not care whether the mother is here or the father is here. If this patient, you have to have some neutral person. Boleh? Because they will take advantage of this, and then you are gonna be framed for nothing. Nampak tak macam? Yang pen, yang. Yang dekat dia sini. Nama? Oh my God, come. Closer. Come. Mana Sabahan?
Ni Sabahan.
Okay. This one kalau surgeon dia need to have that too. Okay. So 3 things. Number 1, then after your introduction, then you go your inspection, right? The inspection can be divided into two, which is general inspection and then specific inspection. Specific is if you are doing the ear, then if patient have glasses like this, you have to ask patient politely to remove the glasses. Dalam bahasa Malaysia cakap apa?
Buka spek.
Ambil screwdriver, buka. Cabut. Tanggalkan. In Kelantan dia kasi buang spek mata kan. Buang spek mata pecah kan. Buang itu pecah. Remove glasses. Alright. So the ear examination is divided into two. A specific ear examination divided into 3 parts. You see this? Pre-auricular, auricular, and post-auricular. Pre-auricular, auricular, and post-auricular. Can you see this? Pre-auricular, post-auricular. So pre-auricular, this area is very important. It's just anterior to the tragus area and anterior to the tragus area. Why is it important? What comes out from this area to the face? You are immune. Facial nerve. So any laceration wound, any swelling, any whatever there, you have to do the examination, the facial nerve examination. The common pathology here will be the pre-auricular sinus, right? Okay. And then you have some. Remember the patient, they have skin tag and everything there, right? So comment about that area. Next is your auricular area, kan? Pinna, ear pinna. Alright, ear pinna. What are the pathology that you know?
Cauliflower ear.
In what patient is that? In what? When you see cauliflower means what? Signs of what?
There's hematoma.
Trauma. What kind of trauma that causes cauliflower ear loud? This one sour, bukan?
No, sour.
Okay.
Hematoma.
Yeah. MVA, trauma, assault, whatever. You have that MMA, right? Okay. So you have cauliflower. Then next, any pathology to the ear?
Laceration.
Yeah, laceration, trauma ear. Yeah. If you have small pinna, what do you call that?
Oh, microtia.
Are you asking?
Microtia.
Microtia. Yeah, microtia. If you have microtia, that means microtia. Another part of auricular is the meatus, kan? So you have presence of the external meatus. You have to tell them, okay? During inspection. Now, posterior auricular area this is the only time during inspection that you can touch the ear. You just flip the ear anteriorly like this and then have a look. You flip the ear anterior like this and have a look. Usually there is a scar here. They call it for mastoid surgery. There's a scar here underneath it. Okay, or you flip the hairline like this. You flip the hairline like this to see for any scar here. This is the scar where you harvest your graft or mangoplasty. You understand? Temporalis fascia is here. You just do an incision here. Okay? harvest the temporalis fascia for you to do the meningoplasty. Boleh eh? So only two surgical scar that you can look for, the mastoid surgical scar here and over here. Okay? There's sometimes they harvest graft over here dekat tragus. Alright? So this is the area. Other than that, you know, maybe a traumatic scar. Okay? Then after that, what do you do?
Palpation.
Palpation, very good. Again, you palpate three areas. Number one, you palpate at the preauricular area by pressing it, right? You can use what thumb? What thumb? Thumb and
Index finger.
index finger, no other finger. Unless you don't have these two, you're allowed to use other finger. You got it? So, now what you do is be professional. Before you touch the patient, say, Pakcik, saya nak pegang sikit. Ha? Kalau sakit cakap okay. Then you hold the head opposite side and you press at this area gently. Right? Press this area gently, you hold this other side. Okay? Press gently or this finger. If there is pain here, listen to my question. Pain here, where is the most likely pathology? Yeah, where is the most likely pathology? External ear, most probably external ear, right? So here you press, rasa sakit, maybe the pathology is in the external ear, okay? After you palpate here, alright, you palpate the pinna. In the book, they say, pull the pinna. Pull the pinna to elicit pain. If you tell me, anyone here will have pain when you pull the pinna, right? So you just palpate the pinna like this. Just palpate the pinna. Don't have to pull. Palpate the pinna. Okay. You feel any pain. If there is pain there, that means pathology at the pinna, or maybe at the external ear also. Alright. Last is post-auricular. Then you palpate behind at the mastoid area. Okay. You palpate gently. If you have pain there, where is the most likely pathology? Huh? Apa? Where is the most likely pathology if you sakit? Doktor sakit lah. In middle ear or inner ear or mastoid area kan? Alright, those most likely pathology. Boleh? Alright, so that's palpation done. What next? Otoscope. Beautiful. Where's the otoscope? There. This is otoscope, right? And what is this? Huh? Pump. Okay, pump. Pneumatic pump, right? Okay. Why use this? After the we Now, this is a otoscope, right? This is the battery part or the handle. This is the eyepiece. Okay. You have to have yes, spatula. Yes, spatula. What is the difference these two? The size, right? The size. You understand? So use appropriate size. They put multiple ear speculum on the table. You choose the correct size for the patient. You got it? This is a pediatric one, right? How to put it here? You put it here. Press gently, not too hard, not too soft. Okay? If too soft, what happened? No, too soft. You put here and then stuck there. And you take it out. I pernah dalam exam, the patient will pull up. Alright, so you put there. Okay, you hold it like a pen. I know some of you hold pen like this, but for this exercise, hold it like a normal people. Pen. Okay, this is a pen. I don't care if you see my registrar holding like this, my MO doing like this, my colleague is doing like this, but for you, hold like a pen. You got it? And this thing, let it hang if you have it. Let it hang like this. Don't put it here. And like nice, very nice. Why? Because when you press this, you have to use this. What happened? Look. The whole thing moves, right? So if you hang it like this, it will not move. Alright? Don't hold it here because it's heavy. You hold it close to the eyepiece. Got it? Boleh. Now look at the green button here. Is that green button?
Yes.
press and twist. Press and twist to on the light. Because sometimes you don't press and twist, the light is not on. You go and have a look, and then you describe me a lot of things. Describe me what? The light is not on, right? See, when you on, adik tengok ni lampu. Okay, takut tak ada. Lampu je lampu. Alright. Now, look, this one you have to see. Come, you have to come here. Alright. When you want to see them here, you see this? There's a tragus there. Okay, there's a tragus there, right? So you have to go behind the tragus, and push the tragus anteriorly and glide in this. That's it. Alright, that's it. You cannot avoid the wall like this. You try to avoid the wall, cannot. Alright, you have to touch the tragus and push it anterior and glide in and have a look. If you cannot see, then you move the pinna. If you cannot see, then this is the last thing you do. So 3 times, right? You go in first, go close to the eyepiece, cannot see, move the pinna. Cannot see, this is the last thing you move. You got it? Don't go in and do this first. Understand? Let's say the ear is problematic on this side. Problematic on this. Is discharge coming off from this side? Which ear you want to do first? No, you stay there. Which ear you want to do? This right ear at the pass, discharge. This is good ear, normal ear. So which ear you want to examine first?
Left one.
The left one. Okay, why?
In case this one gonna cause a further infection to the.
Yeah, they call it cross infection. You don't want to dip this with pus and go and do this. Automycosis on this and then spread on this side. You got it? I know you can change this, but sometimes you take time to change and everything. Okay? Alright, so do that on gaya mutu dan keunggulan. Right? So you go in, have a look. Maaf ya, ke depan sikit. Depan sikit, okay, tengok atas. Depan sikit, atas, tengok sikit. Gaya mutu dan keunggulan. Have a look. Oh my god. Oh, wow. Tengok, nampak eh? Cannot see, then it's the last one. Sakit tak? Tak. Anyone done on you already? Pernah. Yes, sakit sikit tak? Sikit. Yeah. Betul. Okay, so practice. You have to practice. Now, when you do that, you get 5 marks. Gaya mutu dan keunggulan. You get 5 marks for that. The next 5 marks, what do? What you have to explain what? You have to describe whatever you find, right? It's either outside in or inside out. Usually I go outside in. So describe external canal. How do you describe external? Ada 5. Very good. Patency. Patency of the ear canal. Next. Discharge. Any discharge. Pulling of discharge. Next. Swelling of the ear canal. Next. Foreign body. Mass or whatever. Good. How many already? 4. Last one is, oh yeah, the color of the lining of the ear canal. You got it? Describe all 5. Okay? But don't spend too much time describing the wax. Because most of you will describe the wax. I can see yellowish, golden, juicy wax there and there, whatever. No, you have to spend time. Just unless the wax is obstructing the ear canal. If not, everyone will have wax. After this, we show you where the wax is in real time. Okay? All right. Next. Very good. Tympanic membrane. Okay, tympanic membrane. What are the 5 things you comment? Number 1.
Cause of light.
Present. Very good. the TM is present. Number 2. Cone of light. Excellent. No cone of light. Now, the cone on light of light can only be described when you're using this. You got it? Because in the books, they describe cone of light when you use this, but when you use that, it's not described as cone of light. You got it? Alright. So cone of light, apa maknanya? What does it mean?
The light is in cone shape.
So, what does it mean?
Intact. Shiny.
It's normal, right? It's normal, intact and normal, right? So, if you want to describe, you can say, I can see light reflects and it is cone in shape. You got it? You can see light effect and cone shape. Kalau kata, I can see light it reflects but it's dispersed. It's all over the place. What does it mean? Very good. It can be either retract or bulging. You don't know, right? If it's dispersed, you don't know whether it's retracted or it's bulging. So how do you want to know whether it's retracted? What do you ask the patient to do? You ask patient to do this, no? What do you ask patient to do? It's okay to be wrong. It's okay. It's wrong.
Ask.
Vasalva maneuver. Very good. Ask the patient to press the nose, close the mouth, and ask to blow. Right? Okay. You get that retracted TM, bulge up. After this, we show you. Okay. Next. It doesn't move. That means that something is behind the TM. It's bulging. It doesn't move. You understand? What else? What's the color of the TM? Grey. The color is translucent. The color depends on whatever behind the TM. If it's blood behind the TM, what is the color of the TM? In the middle ear, there's blood. Red or
Pink.
blue. Very good. If it's pus in the middle ear, what is the color of the TM? Yellow or green, something like that. You understand? If there is serous color, fluid retention inside there, usually it's tea color, right? Serous color. And there's a lot of bubble and it says bubble. It's just translucent. You understand? Okay? When you get older, the TM become thicker, then you get very dull looking TM. Okay. After that, usually dalam exam we don't give you normal ear. What do we give you? Soalan bocor. Perforated ear. We give you perforated ear. Alright? We give you perforated ear. We ask you to do examination and we show you a picture. Can you describe the picture? Then we give you a perforated ear. Now, how do you want to describe? Very good. The location of the perforation. How do you divide the TM? Four. What? Four quadrants. You can divide into 4 quadrants or much simpler way. Macam mana? Nak divide macam mana the TM? Much very simple. You are not nak ingat 4 quadrant. Oh my god. Superior, inferior, anterior, blah. Like central or marginal. Good. Next. Past tensa or very good. Past tensa or past presida. Done. You describe the location of the perforation. Next. Yes. Size. Very good. Say size. Size. Say size. Size. The size. How do you measure the size? Now. Percentage. Very good. Compare the percentage against the size of the TM. A medical student, senang saja. It's either 50%, more than 50% or less than 50%. Yes, boleh. Come. Boleh. Postgraduate, you have to be more precise. Betul? Yeah. Come. Mana saya? Sorry atas kepala. Fine. Less than 50%, more than 50%.
Neutral ataupun center untuk location.
You got it? So easy. If you see big, say more than 50%. Less than 50%. After the size? Size.
Shape.
Regular or irregular. What does irregular means? So most likely, be humble.
Humble. Sorry.
Most likely is a traumatic perforation. Kan? Be humble lah kan. Traumatic. It's very dangerous. It's very important that you know whether it's irregular or irregular. Kenapa? This is the problem when you have patient that comes to you, assault. You see a perforation when it's jagged, then you kata this is CSUM. That's wrong lah. If it's jagged, ada blood, is traumatic until proven otherwise. You got it? So, regular or irregular, the shape. Next. Listen, side, size, shape. Ada 5, 2 lagi.
S juga.
This one, discharge. D. Okay. If there is presence of discharge, past discharge with that perforation, what does it mean? Patient is having an active infection. In order to do surgery, you have to have active infection or non-active infection. Non-active infection means it's dry. Okay, so you have to comment. Listen to my comment. I can see a perforation at the TM. It is central perforation, 50% above, 50% is regular shape and is dry. You get it? For example. Other than that, last one. Anything that you're supposed to see beyond the perforation. You got it? If there is pus in the middle ear, is there polyp in the middle ear, is anything in the middle ear. Okay, I can see the middle ear and the mucosa in the middle ear is normal. It's okay. You got it? So it's a dry perforation, more than 50%. What is your treatment? Meringoplasty. Very good. Meringoplasty. Jangan sebut tympanoplasty. Why, Sayuti? Tympanoplasty ada banyak kan? Yes. If you say tympanoplasty, maknanya banyak type kan? So just mention meringoplasty. Medical student just sebut meringoplasty. Equivalent to tympanoplasty type 1 lah. Alright? Okay. That's it. That's perforation. That's your otoscopic. Next, what do you want to do? I would like to do a clinical hearing assessment. Say it. I like to do what? Clinical hearing assessment because you are doing in the clinic and it is not a soundproof area. Betul? So clinical hearing assessment is divided into two. And voice test. Hearing test mana? Voice test. Right? Tuning fork test and voice test. Alright, let's talk about tuning fork test first. Tuning fork test, apa yang you patut tahu? What two types of tuning fork test you have to do? Rini test and Weber. What is this? Very good. What is this area called? Base. What is this called? Handle. And this is called fork or vibrating part of the tuning fork, right? Okay. So now this is the base, handle. So you hold it at the handle. You don't hold it here. If you hold it here, less vibration. Betul? Obviously you cannot hold here because you cannot hold it to handle. How to vibrate this loud?
Strike it at the elbow or
What?
strike it at elbow or
Strike it. What do you say this one? Strike.
strike.
You say strike. Okay. In bahasa Malaysia? Ketul. Ketul. Oh yo. Kalau bahasa Inggeris dia bagi tap. Tap on the L. Tap. Kalau nak explain to the pesakit, you say macam ni. Pakcik, saya akan gunakan alat ini untuk menguji pendengaran pakcik. Saya akan bunyikan alat ini. You see that? Bukan saya akan pukulkan alat ini, saya ketuk alat ini. No, saya bunyikan alat ini dan saya letak di belakang telinga dan di depan. Pakcik cakap yang mana lebih kuat, belakang atau depan. Can you do this? Practice it, right? In English, you do it in English lah, right? Okay. Now, how do you again? You ketuk sini. There's only two places that you can vibrate this. Number one, elbow. Number two,
Knee.
okay, knee. Tambah lagi. Make it. Ada lagi version lah? Ada version? How to? Okay. Strike it or strike it. Tap it on your elbow and your knee. Not the patient's elbow or the examiner's elbow. Your elbow and your knee. You got it? No other places. Boleh. Don't strike it on the table. Don't whack it on the heel. And don't flick it. The girls will do it nicely. And they flick it right. But when the guy is doing it, it's so weird, right? No, don't flick it. Okay, you just tap it. I'm tapping this thing already, yeah? This is already tapped. And this is already vibrating. Yeah? Change hand, look. Change hand again. It's vibrating, right? See? So, do you hear me striking this? No, it's just tap. Tap, tap. Okay? Right? Okay, you got it? So practice this. Because last time we don't say it to you properly, you keep on striking this. Strike this. And then there's red here. And then we know that, oh, you just passed your ORL rotation. And then don't strike it anywhere else. I had one student that come to my OSCE. I put all these things there, multiple size. Oh, by the way, 512, 512, 256, 125. Put it there. I said, do a Rini test. That student take one, strike the table, and they just do this. Can you hear? Can you hear? And they put this thing on the table, it start vibrating. Okay, and then they kata, patient have normal ear. What do you think? What marks do I give you? What do you think I give mark? Macam mana? Should I give what? 5. I give Zoko, no Zoko. In my island, they call it 0. Zoko boy. Zoko kosong. Tak boleh apa. Susah. Dia letak balik. And I was holding this nak markah kan. I was like, oh my god. Down here, and then we have that staring session for 6 minutes. Because he take 1 minute, right? You have to so I can, oh my god. Okay, so Rini, yeah. How do you do it? Do this. Listen. Feel the mastoid. Put it the base there. Okay. Dengar. And then alih ke depan and put it like this. Look. Like this. Not like this. Not like this. Not like this. And not like Harry Potter. You got it? Like this. Not like this. Not like this. Not like this. Not Harry Potter. Okay, do that. Boleh practice. Ras bunyi, then bunyi. Okay. Air conduction better than bone conduction, or bone conduction is better than air conduction? Which one is normal?
Air conduction.
Air conduction is better than
Bone conduction.
Okay. Remind me. Where did I stop? Okay, stop here. Alright. Okay, stay there. Remind me in your physics. Standard 1. Remember physics? Okay. Sound travel better through solid or through air? Sound travel better through solid or through air?
Solid.
Solid. Solid.
Solid.
Solid. Listen to the, just now you say, normal hearing is when air conduction is better than bone conduction. In your physics year 1,
Solid.
it
Solid.
travels better through solid or through air? Come.
Solid. Solid. Solid.
You're asking me or you're telling me?
Solid.
Solid. You. Solid. So why is it when you do Rini, air conduction is better than bone conduction? You say normal. While your physics say the opposite side. Why? Come on, Purikum. Yes. Why? You understand my
Yeah,
understand?
understand,
It is
understand.
against the physics, right? Because good. The ear amplify the sound. What components of the ear amplify the sound? The ear canal, the TM, all the ossicles, the round window, all this amplify the sound. So whatever happened to this structure, it will revert back to the physics. Bone conduction is better than air conduction. You understand this? This is favorite question for Oski. Basic belajar satu lah. Ya. You got it? Boleh ya? Faham? Good. So what do you call this again? What do you call this again? This is a Rini. No, this is not Rini. This is modified Rini. The one that you read is the classical Rini, which is what? Look, classical Rini. You put there and say, can you hear this? You tell me when you cannot hear this. Can you hear this? If this patient is a good hearing, it will take about 5 to 7 minutes for it to diminish. So you have Oski what? 10 minutes. So by that time you're finished, right? So now that's why you use the modified Rini, which is just to compare the intensity of the sound. You understand? Beautiful. That's your Rini. Next is what? Weber. Look, Weber. Eh? Wait, Elina, Nazra, wait. Okay. You learn today. After the day, you watch. You vibrate this thing, you tap, you put it here. Put it here. Where can you hear? Right or left? Tak dengar. Good, it's okay. Tak dengar, it's okay. If you tak dengar, you put it here. Vertex. Boleh eh? Be professional. Place your hand here when you put here. Don't do this. Do that. Or same here. Don't do this. You just make sure you have a hand support. So patient cannot hear here, or patient say I can hear equally. Fine. Weber means Weber is good. Weber, right? Let's say this is a Punjabi guy. You know Punjabi? Punjabi guy. A turban, very big turban here. Where do you place this? Where do I stop? Yeah, Sabahan. There's a big turban there. Where do you put it? You put it here. Very good, here. But this guy had a very big pimple. You can't really put it. Explode. What do you put it?
Here.
Very good. Here, right? You can. But there's a big mustache there. Where do you put it? Here. Punjabi guy. Big turban, big pimple, mustache, beard until here. Where do you put it? At the big turban. Have you seen a Punjabi guy? Where? Gigi. You play no gigi. A dentalist. A dentalist, no gigi, big mustache, big beard, pimple, turban. Where you put it? What is Weber? Is it air conduction test or is it bone conduction test?
Bone conduction.
Where's the bone here? Where's the bone? The whole thing is a bone, right? You can put anywhere you want. So why do you choose this area only? Bias. Yeah, if you put it here, tend to see here, tend to have bias. So you put in the middle. You got it? Actually, Weber. You have to know why you put there, why you do this. You understand? So that's your
Weber.
Weber. Last but not least,
Voice test.
Voice test. Listen, voice test. Okay. Now, the voice test is you use your voice. Now, Pakcik, saya akan menggunakan suara saya untuk uji pendengaran Pakcik. Boleh? Saya akan sebut abjad dan number. Pakcik ulang balik. Boleh? Okey. Contoh 35B, 78C, 55D. Okay. He understand, so therefore he can do the test. You got it? Now use your hand, this hand. If you test the right hand, right ear, use this hand, slap it. No. Use this hand and block the eye. Why you have to block the eye?
See the mouth.
They can, but yeah, wearing this. No, I'm just kidding. If you don't wear this, even they can lip read, alright? So you block this eye, and this one, this is the only time that you use your middle finger. Push the tragus in. Look, push the tragus in and rub the middle finger. You got it? Okay, you can do it all. Push here and rub the middle finger. Rub the middle finger. Rub the middle finger. Why you do this? Masking. Again,
Tekan kuat sikit.
push the tragus in. Push the tragus in, not put your finger into the ear. If you put that, you will see something there. You know, you see something yellow there, you sniff. No. Push and rub and block this arm and do it. Arm length. Look, one arm length. 35B, 78C, 55D, 38B, 27A. Very good. Patient can hear your conversation level. You got it? Can repeat 5, normal ear. Can repeat 3, normal ear. Can repeat only 2 or 1, then you have to send for pure tone ordinary. You got it? Now, when you can hear conversation level, then you shout or you whisper? You whisper, okay? Again, you don't have to whisper, you say it normally. I whisper, he whisper. 38C, 38B, 38B, 38A, 38A. Normal here. If patient cannot hear your conversation level, what do? You whisper, you shout. Shout. So you shout. So what is the normal conversation? Berapa decibel?
500.
60. My God.
40,
Who's the
40, 40.
But 20, 10, 20, that's your conversation level. You understand? But you have to check. Go to the audiology clinic. There is an instrument there to check your decibel. Maybe Sabahan's shout is same as Izahar whisper. Okay, so you have to check your conversation level. You understand? Now, once you can do that, that means that you know where's the area, where's the patient punya hearing. Is this a subjective test or objective test?
Subjective.
Is it subjective? Then you have to go to the more objective test, which is the your tone or your don't say PTA in the exam, huh? All right, that's it. I think that's all for hearing assessment. Boleh ya? Now, what's the common problem in hearing? In ear, what's the common problem? Hearing. I told you already. Hearing. So you have to know 5 conductive hearing loss, 5 sensory hearing loss. You understand? Mesti tahu, eh? What is the infection of the ear? Infection of the ear canal. Otitis externa, very good. Fungal in the ear canal. Die.
Mycosis.
Otomycosis. Infection in the middle ear. Very good. Pus coming out from a perforation in the middle ear, from the middle ear. What do you call it?
Chronic suppurative.
Checksum, huh? Chronic suppurative otitis media. The TM is bulging with pus about to explode. What do you call it?
Pre-suppurative
Acute
otitis.
suppurative
Acute
otitis media. You got it? Once it blow, ada lubang, checksum. You got it? You got it? There's a picture with a yellowish asum. Cik Sum. Bubble in the middle ear. You can see the TM of the bubble. Middle ear effusion. Got it? So done your infection. Let's say you have something inside the ear. Something is moving inside the ear. Itchy, all is moving, very painful in a child. What do you do?
Foreign body removal.
I know foreign body removal. How do you do? Patient is in pain, it's moving. Maybe it's insect inside there.
Alligator.
Alligator cannot go inside the ear. You kill the insect. How do you kill it? Don't tell me. Use a shell talk with that. The shell talk or whatever, spray inside the ear. You use that? What? If you use that, you know how many dies? The insect, the patient, and you. What do you do?
Maybe can use oil.
Very good. You drown the insect. You drown and kill the insect. You can use oil, but you can use also. Why if saline and oil, I prefer oil? Why? Oh yeah, why? You do the experiment at home. You go back in your hostel. You go lift up your bed, right, and then find a cockroach, 2 cockroach, pick it up. Put a glass, put one in each glass, one drown with water, another one drown with oil. Tomorrow morning, which one will be bloated? You know what bloated is? Which one? Water will be bloated. So when it's bloated, when you remove, it will be removed pieces by pieces. You got it? So when you kill with water, you will remove pieces by pieces. When you kill with oil, it will be removed intact. What kind of oil you use? Baby oil. What other oil you can use? Cooking oil. Fresh one. Fresh cooking oil. Don't use the one that you have been cooking, frying the fish, and put in the ear. Or still boiling, put in the ear. The fresh one. Other oils? Olive oil, very expensive, but you can use. You understand? There's 2 types of insect. 2 types of insect. Right? This is my definition. You can quote me if you want to. 2 types of insect. Number 1, that love this. They love the light. They go to the light. So if you're lucky, you shine a light there, it comes out. Lucky one. But most of the time, the insect that goes into the ear is the one that is afraid of light. So when you shine, what happens? You will go deeper. That's why when you see that the butt of the insect looks like a cockroach. Oh, there's a cockroach. Enough. You put oil inside there, kill it. When you see butt of cockroach there, don't call your friend. Hey, come on. It will scratch the wall and it get painful. You understand? So you kill it and then remove it tomorrow morning. Okay? Boleh. Can you do that? Now, if foreign body in the ear, in children, if you see all this, I allow you only 2 attempts to remove. Why? Because patient that goes to see you, they already attempted to remove the foreign body. You understand? If there is insect inside the ear, who's the first one to remove this? No, the patient. Kadang-kadang dia letak something in the ear, they menyesal, they try to remove, very painful, they go to the
Clinic.
second one, they go to what?
Mother.
Mother. They go to the mother. Mother will do it, belas kasihan, try to remove, cannot do it, trauma, Mother will send to? No, the father. The father will go, come, let me do it. Try to do it. Huh? Cannot do it. Trauma. How many times already? 3 times? Right? What next? Father will do what? Father will go to the grandmother. The grandmother will come because father used to do this. Father used to, when I'm small I did this, so my mother did. Grandmother kesian dia dengan glasses like this, cannot see, try to remove trauma. What the grandmother do? Grandmother will send to the Bomo. Sorry, grandfather passed away. Grandmother will send to the Bomo. The Bomo will speak whatever inside there. Cannot do, cannot remove. How many trauma? 5 times already. The child is traumatic already. So last thing what? What the Bomo do? Last thing, Bomo will take out a piece of paper. Right there, dear Prof. Ramiza, I'm referring again. Finally, the Bomo will send to the hospital. You understand? And then send to you, and then you have two attempts to do. All right. If you cannot do, then leave it. Send to a proper clinic. If you don't believe me, you can see on the wall outside scratch mark of children, traumatic children, when they bring to the clinic. You understand? Nampak? So that's why you see people do popiah.
Oh, yeah.
Children popiah.
Yeah.
Trauma, right? They are traumatic and they. Okay? So, can you do this again? Boleh ya? So practice this. And then remember, children are very traumatic kalau you remove foreign body and everything. Okay? They purposely do. Children who put something in the ear or nose, right? They tend to do it again. So do not scold them. Never scold them. Marah. Why? Because they tend to put it. Okay. If you scold them, what happens? If they do it again, do they go and see you? No. You understand? You have to understand why. Sometimes why they put something in the ear? Very itchy. You cannot, they don't know how to say. They put inside them. It's also common in patients in 5th floor.
Psychiatric.
Okay. I have a patient where they put, the color pencil. They break the tip and they push inside the ear. And I ask the child, adik letak apa? What do you put inside the ear? I say I put a ujung color pencil warna kuning. So when I do, I say, yeah, kuning. I remove one. I check again, warna hijau. Then again, warna merah. Yeah, all color, all 6 color. I say, why? You see only yellow? Oh yeah, I put yellow. The rest, my friend. Okay. There's also one story. They put something in the ear. The doctor have a look and pull out a very small fire engine. Fire engine. You know fire engine? The red fire engine. Remove fire engine. They didn't see the ear. Came back home, sakit lagi. Come back again, go in again, remove a very small fireman. But before the doctor discharge, the doctor say, why fire engine and why fireman? So they go in again, they take out a small dog. Do you understand? Initially, the patient put a dog, cannot remove, send a fireman, cannot send a whole fireman. So you have to think. Logic. Okay, I think that's all for today. So guys practice and then we'll see you during your revision.